Welcome on board the Newstrack. I'm Rahul Kanwal. What would the third wave in India look like? On the Newstrack tonight, we will show you the latest projections being done by top infectious diseases experts inside the government, outside the government, who are modeling the total number of case counts, who are looking at the number of hospitalizations that might be required. We're also looking at what's happening in South Africa, the UK and the US, because what's happened abroad is likely to get replicated in India as well. We saw it with the Delta wave. It's likely to happen again. We'll have answers to questions that have been in your mind but you didn't have firm answers to before. We put that all together and we'll be bringing that out on the Newstrack tonight.
Weekend curfew in Delhi. Lockdown warning in Mumbai. Curbs return as Omicron surges. But no restrictions on rallies. Do weekend and night curfews work? When will India witness Omicron peak? Is India prepared for Omicron wave? Big focus on the Newstrack.
It's now clear as day that the Omicron wave has begun in India. Cases are surging, curbs and curfews have been reimposed. The capital has imposed a weekend lockdown starting Friday 10 p.m. Night curfew is already in place in several big cities across the country. But election rallies continue unabated. Delhi Chief Minister Arvind Kejriwal and several other netas have tested positive after big election campaigns, which makes us wonder, do these weekend and night curfews really work? Is there science that is guiding our political establishment into taking the decisions that they are, or are all of us being inconvenienced? But the netas are doing what they know how to do best, going out and politicking, going out and campaigning, going out and canvassing for votes, regardless of whether their rallies turn out to be super spreaders.
Delhi government has announced a weekend curfew starting 10 p.m. Friday night in view of a surge in COVID cases driven by the fast-spreading Omicron variant.
दिल्ली में सैटरडे और संडे को यानी वीकेंड्स पर अब कर्फ्यू रहेगा, तो लोगों से अपील है कि कर्फ्यू के दौरान बाहर ना निकलें। बहुत ज़रूरी होने पर हॉस्पिटल या कोई बहुत एसेंशियल ज़रूरत पर ही बाहर निकलें।
Mumbai civic authorities say there may be a lockdown if there are over 20,000 COVID cases per day.
जो हमारा राज्य सरकार है और जो हमारा केंद्र से आने वाले जो नियमावली है वो कह रहे हैं कि ऐसे ही 20,000 के ऊपर रुग्ण पाए जा रहेंगे तो लॉकडाउन लगाना जरूरी होगा.
With curbs back, the debate over whether night and weekend curfews work has been reignited. The doctor who first raised an alarm over Omicron says these restrictions won't work.
So any sort of night curfew or any restrictions vis-a-vis some sort of a lockdown, closing down of markets, that per se you're saying is not going to work in the case of Omicron?
It's already everywhere. That's why it's difficult. So what we have done, we do have a curfew. 11 o'clock at night, all the restaurants must be closed and until 4 o'clock the next morning.
In India, expert opinion is divided on whether night curfews and weekend curfews and similar restrictions work or not. While many experts say that these measures, when announced, send out a message that it is time to follow protocol very, very strictly. There are others who say that these measures serve no purpose and smarter curbs throughout the week at all times of the day actually work better.
When a night curfew is imposed, it is a clear message to the community that the virus has risen again and we need to be careful. Imposing restrictions during the daytime affects the livelihood of a lot of people. In the absence of better alternatives, night curfews do have a place in restricting mass movement.
If we start using data sensibly, then we can tailor our response in a manner that is scientific, instead of doing things like weekend curfews or night curfews, which are not only not going to slow down transmission, but we're also going to lose public compliance, because the public will see that there is a hypocrisy inherent in allowing gatherings for political or religious reasons, but curtailing and putting restrictions on everyday Indians that don't really impact transmission.
The subject of our
WHO Chief Scientist Dr Swaminathan says there's no science behind curfews when it comes to tackling the spread of COVID-19. She says countries must formulate science-based policies for curbing the virus. So far, restrictions have only been placed on the common man, while election campaigns continue and netas address huge rallies. What is the science here? In New Delhi with Sneha Modani, Bureau Report, India Today.
The one question, I'm sure, which has been on your mind is how bad will the Omicron wave get in India? What's happening globally? What are the lessons we can draw from what's happened in South Africa, the US, the UK? We'll try and answer some of those questions in this part of the Newstrack. I'll show you first the current Omicron wave the world over. If you see already from countries like India haven't hit the Omicron wave just yet, and therefore those numbers will add to this tally later, but already on the basis of what's happened in countries in Europe, Africa, in the United States, 9 lakh plus cases have been reported at the peak of the Omicron wave at this moment. In comparison with the Delta wave, when we saw 7,92,000 cases, this is the global peak which we're talking about. We're already more than the global peak when it comes to Omicron, and a country like India, which is 1/6 of humanity, hasn't hit the Omicron wave in real earnest just at this moment. This is now the United States, where again, if you compare with the waves that have been seen in the past, including the Delta wave, which was the most severe wave so far, the Omicron wave in terms of the number of cases is already more than the previous waves that have been seen in the United States. I come now to the data from the United Kingdom. In the United Kingdom, in fact, the Omicron wave is more than double of the two waves that have been seen. The first initial wave and the maximum number of cases reported was 47,647. This is for a much smaller country and a smaller population. The Omicron wave at 1 lakh plus cases already. Now let's come to the data from India. Here, the maximum number of cases that we saw was on the 22nd of May, 2021, when we saw 3,45,000 cases. This is an average daily case over a 7-day rolling period. Whereas in January, from the 25th of December to the 4th of January, the maximum number of cases that have been seen are 17,058. So we've already seen globally, we've seen in the US, we've seen in the UK, the number of Omicron cases rising, and this Omicron bar is likely to rise much more than the Delta wave, which was 3,45,000 on a 7-day rolling average period. Now, if we were to project, what could the Omicron wave look like? And I have two top doctors giving us their projections. These are experts who are doing their modeling, and they've been modeling all through the pandemic. I'll start with Manindra Agrawal. He's a professor at IIT Kanpur. According to the wave that he's putting out, the data that he has, his sense is that the Omicron wave in India will peak in February, and he believes that India is likely to follow what happened in South Africa, not Europe. And why? I'll ask Manindra this question in just a moment. He's joining us on the show because the age profile of India is similar to people in South Africa. There seems to be similar natural immunity as well, which is different from what we're seeing in the countries of Europe, where the natural immunity isn't quite the same. So Europe, having low natural immunity, is seeing cases flare up in a way different from South Africa, which saw a very sharp peak and then an equally sharp decline. Hospitalization is expected to be low, according to the model that Manindra Agrawal is putting out. A quick fall in cases after the peak. We'll try and see which week of February he expects the peak to be in. Let's now come to Dr. Swaminathan. Dr. Swaminathan is the Director of Infectious Diseases and Infection Control at the Global Hospitals of Glen Eagles in Chennai. He is projecting that the number of cases could, by the end of January, go up to 20 lakhs. I showed you that on a 7-day rolling average basis, the maximum number of cases were 3,45,000. That could go up to 20 lakhs according to the projection that Dr. Swaminathan is putting out. That's a big number of cases. The relief though is that the level of hospitalization is likely to be low. But even if you don't actually hit a figure of 20 lakhs, it could be because testing may not keep up. So his sense is that the cases will be around 20 lakhs, but maybe the numbers don't reflect it because testing may not be able to keep up with the speed at which Omicron is spreading in our country at this time. The third wave, mercifully, likely to be less severe than what we saw during the Delta wave in India, and that really is a big mercy. The number of fatalities could be 1/6 of the Delta wave, according to Dr. Swaminathan's projections. And again, he believes that what's likely to happen in India is that we'll most probably follow the trajectory of South Africa. And why is it that these two experts are thinking what they are? To talk about this, I now have on this broadcast Dr. Swaminathan. He's joining us. We also have with us on this broadcast Dr. Manindra Agrawal, the professor from IIT Kanpur. We'll talk about what's happening with their projections and why. I just took you through their data. We have Dr. Ravi Malik. He is seeing a lot of COVID patients, is giving us a sense of what city hospitals are seeing. He's the CMD of Radix. Also with us lastly is Harsh Mahajan. Harsh Mahajan is the founder of Mahajan Imaging, and I had a lot of questions, as I'm sure you do as well, about how do I test for Omicron? What kind of, should we just buy some antigen test and keep it? And if the number of cases is going to skyrocket in the way that they are likely to, then there will be increasing delays in getting test results. So how do we deal with some of that? We'll ask these questions to Dr. Mahajan in just a moment. I want to go across to Dr. Swaminathan first. 20 lakh cases is about 4 times or 5 times the maximum number of cases that have been reported in the Delta wave on a daily basis. Do you really think that that's the number that India could hit on a daily basis? How confident are you that the projection that you've put out is most likely what we'll see over the next few weeks in India, Dr. Swaminathan?
That number is a ballpark number. But having said that, if you look at the rolling average from the United States, end of December, on a single day, they hit 5.85 lakhs. 5.85 lakhs is a lot of cases, and they've never had these kind of numbers ever. And please understand, these kind of extraordinary numbers are being reported everywhere. If you look at the ratio of the Omicron numbers to the Delta peak, whether it's UK, whether it's US, whether it's South Africa, all of this are following a similar trajectory. So I think our numbers may be less than 20 lakhs, possibly because of lack of testing. Again, with those kind of numbers, it's just going to be impossible for us to do RT-PCR in everybody, and the rapid antigen test may or may not get captured, and therefore we will humongously underestimate the actual burden. But having said that, I stand by what I said in terms of rough numbers. It may be 15 lakhs, but I don't see it much less than that. I suppose somewhere between 15 and 20 lakhs is where I ballpark it.
That's as far as the total number of COVID cases is concerned. If you were to look at the level of hospitalization and the level of deaths, and if you were to compare this data with what's happened in South Africa and elsewhere, what are the kind of ICU use cases you're anticipating, the number of hospital beds that will be required at the peak? If we do hit a peak of 20 lakh, how do you see our hospital capacity currently being equipped to deal with those kind of numbers?
Remember, if the peak is hit at one point of time, your hospitalization will lag by about 10 days. So you're going to see a huge rise in numbers requiring hospitalization only 10 days after that. But in terms of absolute numbers, it will be high, because even though the relative numbers are pretty small, with a huge number falling sick, there will be a significant number of people accessing healthcare. Overall, I suspect the numbers will be probably slightly better than first wave, but definitely not as bad as second wave. Given that South Africa, I think the mortality they reported peak was about 1/6 of the Delta wave. Modeling based on that, I would say it will probably be slightly better than the first wave. It will be manageable. The issues are going to be, healthcare supply. Given that there's a lot of healthcare providers calling out due to COVID, I think manpower handling is going to be a bit of a challenge. I think that is going to skew the statistic a little bit to make it a little more difficult for us. And I think that's where we need to plan a little more carefully, because this is happening in the Western world right now. And they are facing a situation where the National Guard is being called in for emergency help and things like that.
Okay.
So, I mean, I think those are issues which also need to be factored in. Even though the numbers may not be that high, there may be a mismatch between the facilities required and what we can provide at that point of time. I'm not talking about beds, I'm not talking about oxygen, I'm not talking about ventilators, I'm talking about manpower.
When do you anticipate the wave to peak according to the modeling that you're doing right now? And how many weeks will it be before this nightmare ends?
Well, Mumbai is already on the very, what shall I say, expansive trajectory. I'm expecting Mumbai to peak between the 15th and 20th of this month. And most metros will be probably 5 to 10 days maximum.
No, one second. I want to pause you for what you're saying. You're anticipating that the peak will be as early as the 15th to the 20th of January.
Yeah, in Mumbai at least.
So you're anticipating a peak in just about 10 days from now. So you're saying it's really like a hockey stick like increase and an inverse decline.
That's exactly the kind of model that has come through from almost every country which is showing these numbers. See, please understand, once you hit a 2% test positivity rate, it reaches 20% in less than a week. So that basically means once you get to 2% test positivity, you're now on an exponential trajectory, and you're not going to take too much time to get to a peak, maximum 2 weeks. And after that, it's going to be downhill. So we are very.
How long will that reverse of the peak be? So if it goes up?
Excellent. It seems to be a symmetrical peak because it doesn't seem to behave differently. Therefore, I expect a quick up and a quick down. I don't expect a taper down. Having said that, there are obviously unknowns here, because there is this new variant which is being reported from Marseille, which I think merits some attention. No panic as yet, but certainly there are some things about the Marseille strain which is interesting, to say the least. So obviously those things need to be factored in. See, please understand that last year, although we call it the Delta wave, it was not just a Delta wave. It was actually 2 waves in one. It started off with the Alpha, and then it was quickly shoved aside and Delta took over. So we actually had 2 waves there, not one. So again, it all depends on timing and the global movement of
Let me hold you and ask this question. If your peak in your model at this moment is between the 15th and 20th of January for Mumbai, what is your national peak projection?
Before the end of the month.
So you really expect, I mean, I can see it in our newsroom. We're seeing cases being reported, as I'm sure people who are watching at this time will know people around them who are reporting COVID cases. You're anticipating that the national peak will happen by the end of January.
Yeah.
And how many days on the other side of the wave before the cases come down and life actually becomes as close to normal as it was between these peaks?
See, please understand that by mid to end of Feb, the numbers will come down. But here's the problem. That's the diagnosis. You're not talking about hospitalization. The hospitalization curve will lag by about 10 days. The ICU care and the ventilation will lag by another 5 days behind that. And mortality another 5 days behind that. So therefore, please understand that the need for healthcare is likely to remain a bit of a problem till maybe end of March. The cases may come down in February, but healthcare will still have to, manage numbers till maybe end of March.
Okay, but at least as far as the reduction in case count is concerned, which is really the first marker that you're looking out for, from the end of January, which week of February do you think that will happen in?
Second half, probably the second, third, maybe even the 4th week, but probably second to third week.
Stay with me for a moment. I want to go across to Professor Manindra Agrawal and get his sense. And I want to press him on the question that I asked you. Dr. Swaminathan projecting that the peak nationally will be by the end of January. He anticipates that the peak in a city like Mumbai will be in the middle of January. Professor Agrawal, is that the data that you're picking up as well based on the modeling that you're doing looking at global trends?
Well, okay, let me clarify the data or the projection that you earlier alluded to that I have made. That was really made when there was no data available from India. So one just picked up what happened in South Africa and assumed that there's something similar would happen in India. And that's what led to that projection. But now that we have data coming from India, it is clear that happenings or the trajectory in India is quite different from the trajectory in South Africa.
Why and in what way?
I do not know the reasons.
No, in what way, sir?
That's something for biologists to investigate.
I don't understand you. When you're saying that the trajectory in India is different from the trajectory in South Africa, why do you say that?
It's rising much more rapidly than expected, as happened in South Africa. So what appears is...
No, one second. You're saying our cases are rising faster than South Africa?
And also what appears is that the loss of immunity in South Africa, what is the percentage of people who lost immunity? In India, a higher percentage of people seem to be losing immunity. Unfortunately, the data, our model simply learns the parameter value from the data. So there is not sufficient data for the model to learn the parameter values. So we are just waiting for maybe another week before we can make some predictions.
Why do you say it? I don't understand. Why is it that you're saying that the percentage of people losing immunity in India is more than the percentage of people who seem to have lost COVID immunity in South Africa? If the age population, if the age breakup is roughly similar, the countries are similar in many ways, why should this be happening? I understand the difference from Europe, where natural immunity is lesser, but I don't understand why you're saying India is trending differently from South Africa.
Well, nor do I. I mean, I'm just saying that this is what the data is showing. Why is it happening is something that for virologists to explain. I cannot explain that.
Okay, let me ask you this. According to the projections that you are doing, and I understand that you're looking at it just from the perspective of data and what is happening globally and trying to apply that to India, so we have a forward-looking sense of what may happen. When do you anticipate cases in India to peak, sir?
So, like I said, our model has not yet been able to learn the parameter values for this new phase because the parameter values are still changing. I am expecting them to stabilize over next week or so, and then I can start making predictions through the model. So as of now, what I can say safely that earlier prediction of peak in February at the level is not likely to be correct. The peak will arrive earlier. How early I cannot right now say, but certainly earlier and at a higher level.
I must tell our viewers this, that Dr. Swaminathan was with us, I think about 10 odd days ago, and he said this at that time as well, that the peak would happen towards the end of January. So his model was picking that up, whereas the other models at that time seemed to be suggesting that the peak would happen towards the third week of February. So that seems to be getting advanced. Dr. Swaminathan, can I press you to try and explain to our viewers why India is trending differently from South Africa? Is it correct that the loss of immunity in India as a percentage of our population is higher than South Africa? If the countries are similar in terms of their age breakups, why would that be the case?
No, actually that's a very important point that he's made, and let me explain this in the way that I have understood. Delta becomes a very, very important point when it comes to Omicron. Why? If you look at what's happening in South Korea and Japan, both of them are very similar in the way their cultural constructs are and following of rules and masking and vaccination and things like that. But South Korea is having a terrible time with Omicron right now, increased cases and deaths, whereas Japan is not having a bad time. In fact, South Korea is the one which is zooming forward with the booster. Japan is not even doing that. Why? Because one thing that comes across very clear is that South Korea did not have a Delta wave in the last 6 months. Japan had a significant Delta wave. And it's my premise that whenever you have a bad Delta wave, it does give you protection against severe Omicron. See, the problem is previous infection does not protect you against repeat infection. But previous infection does have significant benefit in terms of preventing severe disease. And that's one part of the modeling that I will give you. I can't tell you everything that is part of my model. The other thing is that the X factor, which he alluded to, I'll tell you, that's what worries me. Our Delta wave was in March, April, maybe May. And that's quite a bit of a time gap. Having said that, in vitro studies have shown that one vaccine plus one infection is as good as 2 doses of vaccine plus a booster in terms of preventing severity as far as Omicron is concerned. Of course, this is for the Pfizer-BioNTech data, but I'm sure this is extrapolatable to everything else. So I am reasonably confident that the bad Delta wave and the high seroprevalence that we had at the end of it, combined with significant vaccine penetration, will result You won't be able to prevent the peak, but in terms of misery, in terms of severe disease, I am expecting that to mitigate it significantly.
That's a relief. That shorn of jargon, that essentially means that you're likely to get infected, but it is also likely, if you don't have comorbidities and if you've been vaccinated earlier and if you ideally had Delta and recovered, then you have some kind of immunity against severe disease. That is important. Dr. Malik, what is it that you are seeing, hearing at your own hospital, from what you're picking up from all your doctors groups? How bad is it? We're already seeing several signs in our newsroom, elsewhere, of the COVID week really kicking off almost like a hockey stick, wickets falling virtually every hour.
There is no doubt about it, Rahul, that the cases are astronomically increasing, and we are expecting a tsunami of cases to come forward now, because right now, in last 24 hours, we have witnessed 37,000 of cases, but that is because we have tested only 11 lakh people in our country. If we increase the rate of testing, I think there are many those who are hidden even today. And the way the things are happening in US and UK, to some extent, we are likely to follow that trajectory. Although let me tell you, it is an unpredictable disease, and we have faltered many times in forecasting its course. But by and large, what I expect is that by the end of this month, our country will be having, I fully agree with the previous panelists, that we will be witnessing about 18 to 20 lakh of patients. And one very important critical concern I will like to tell you as a professional is that let us not shrug this disease that it is just mild disease. I think people are getting very overconfident about it, that it is only a mild disease and nothing is going to happen to them. So that is why probably they are more careless. According to WHO, no variant till date is so mild that it cannot make the people sick, or the people will not land up in ICU. So having said that, we should be cautious. Of course, this variant is a little less aggressive as compared to Delta. There is a recent study which has come which shows that in the selected group, 30% of the people were admitted in Delta group, and only 18% of Omicron were admitted. So we cannot say that there will not be any admission and the people will not be getting sick. Having said that, one very important pertinent point I will like to mention is that our healthcare structure is likely to have a lot of burden on it. Ultimately, people will get their testing done, they will get their prescriptions from the doctors, and of course, many of them will be admitted also. So healthcare burden is likely to be there. And
now, I want to make this point. In the US and the UK, the media is full of reports of how hospitals couldn't take care of patients, and patients being severely impacted, not being given medical treatment because they simply didn't have enough doctors and healthcare workers, and that is a huge concern. If all the healthcare workers and doctors fall sick at roughly the same time, then hospitals simply won't be able to function at full capacity. I want to go across to Dr. Harsh Mahajan. Dr. Mahajan, every person who's watching at this time will want to know, how do we figure out if we've got Omicron? I saw there were some new testing kits that came out which specifically target Omicron. Then we sent our reporters to try and see if they were available in the market. They're not. So if the testing kits for Omicron aren't available, and if all you have are the regular RT-PCR and the antigen tests, to everyone watching, if they're seeking advice from you, what would you be telling them?
Thank you very much, Rahul. This is a very important question. And let me put it in context. Point number one, Omicron or Delta, these are the two variants that are prevalent now. Both of them test positive with the present RT-PCR kits that are available, as well as with the rapid antigen tests that are available. However, with the kits available, you cannot differentiate even on the RT-PCR test kits, whether it's Omicron or it's Delta, though you will come out positive. Now, the other RT-PCR kit that you talked about is a kit which is an imported kit, cost nearly 15 times what the regular kits cost. And this has come into its own because it has what is called a S gene, which is tested for. And with Omicron, you have a S gene target failure. meaning it doesn't turn up positive for the S gene, whereas the Delta variant is positive. And hence, this is an relatively inexpensive way of differentiating one from the other. Now, several states have started using a two-pronged system. One, first they test on a regular kit, pick up the positives, and then these positives are run again through the second RT-PCR kit, and those where there is S gene target failure, those are then sent for what is called genome sequencing, which I'm sure all your viewers have heard of. And this is actually the gold standard test, using which you can very definitely say this is Omicron based on the mutation pattern that we show up on the genome sequencing, and it is different for the Delta variant.
I have a follow-up question for you, which is this: does it matter? Let's assume that you test positive on an RT-PCR. Of course, as a matter of curiosity, I would like to know whether it's Delta again or is it Omicron this time. But clinically, from a healthcare perspective, does it even matter whether the person who's tested positive has the Omicron variant or the Delta variant?
That's again a very, very good question that you asked, Rahul. Now, it matters to the extent that for knowing the spread of disease and for knowing whether the Omicron variant is overtaking Delta and is now the predominant variant, it is important. However, for treating a patient, it may not be so important because the patient is treated on the same parameters of symptoms and signs, the oxygen saturation levels, the degree of problem that he has. Based on that, the patient would be treated. So it is important to know the epidemiological prevalence of the disease, of the variant, and also do remember that as we have more and more of these infections in the community, every new infection increases the risk of further mutation of the virus. So Omicron may mutate to something else. It becomes the predominant variant as Delta did in May, June, and after that. But to know whether Omicron is changing to something else, which may be more lethal, which may be more contagious, God alone knows. There again, it is very important to continue to do genome testing to be able to find that particular time where it is changing and then contain in that geographical location. Like someone just pointed out, in the south of France near Marseille, there is this IUO variant that has been detected in about a cluster of 12 cases. And if they had not done genome sequencing, they wouldn't have found this out. So it's very important to continue to do that. But for any individual who's been infected, it may not matter as far as treatment goes.
So I want to show our viewers this report compiled by our health correspondent Milind Sharma, which looks at the traditional antigen and RT-PCR test kits which are available currently at labs, at pharmacies, and this whole issue of S gene dropout and whether they're able to pick that up or not. It is critical to determining whether you have Omicron to be able to find out the S gene dropout. For now, genome sequencing, as Dr. Mahajan said, is the only way to detect the Omicron variant. The ICMR has now approved testing kits that will reduce the burden on genome sequencing. Here is Milan's report.
If you catch COVID, chances are you will not get to know which variant infected you. This is because genome sequencing is conducted on only 5% COVID positive samples. To ease the trouble and reduce the burden on genome sequencing, the Indian Council of Medical Research has validated a new kit, Omicron. It's a COVID test kit made by Tata Medical and Diagnostics Limited. This RT-PCR kit amplifies RNA in a virus to detect the genetic material. When the test detects the presence of other genes of the SARS-CoV-2 virus but fails to detect the S gene, it is considered indicative of Omicron infection. S gene dropout is a trait associated with Omicron.
It's very difficult to comment a patient who is COVID positive, whether it's an Omicron or something else, because we don't have that kit. It is something known as gene target failure detecting kit. That is being imported by the government, and very soon it will be available as a dual PCR. At the first PCR, you detect it's a COVID. The second PCR, you detect that we are not able to detect S gene. So, right? So likely this may be Omicron. So need not to send a sample for gene testing and for the particular strain. So this is an indirect way to detect this is a Omicron or is it Delta or something else.
The ICMR has also created another COVID test kit, but it has failed to find interest among manufacturers. The only kit approved by the World Health Organization is TACPath RT-PCR kit, made by US-based Thermo Fisher Scientific.
Fortunately, we did not have an Indian RT-PCR kit till now that could detect the Omicron variant. We had to depend on the imported TACPath kit, which was made by Thermo Fisher of the United States of America. But ICMR, in association with Tata Medical Diagnostics, has now made the OmiSure kit, which is made in India, so therefore it is very cheap.
The Alpha or B117 variant 2 sees S gene dropout, but its circulation is low in India. When S gene is not detected in the virus, it is considered to be Omicron. But genomic sequencing may still not lose its relevance. The S gene dropout is not being detected in a variant of the Omicron lineage, BA2, which has seen further mutations.
Why is it important to know which variant you are infected with, so that you can move forward to an appropriate line of treatment? If it's Omicron, then monoclonal antibodies don't work on such people. And also after 5 days, you will turn asymptomatic. But if it's Delta, then it can cause COVID-induced pneumonia in the lungs, and you can need oxygen. Only an S-gene failure target test will help determine which variant it is. With Pawan Kumar in New Delhi, Milan Sharma for India Today.
There's a new South African study that's come out which compares across different parameters what happened during the Delta wave with what's happening during the Omicron wave. And this is illustrative, even though it's not completely replicable in an Indian context, but it does give you some sense of how Omicron is different from Delta. And I want to take our viewers through that on a point-by-point basis to give you a sense of how to compare the two waves. So just give us a minute. We'll call that up on our screen, and then we can compare how the people being affected, the number of cases being reported compare. So let's take it one by one. This is a study, as I said, done in the end of December in South Africa. The average age, the median age of the patients for Delta was about 59. The median age for the patients for Omicron is 36, median being the middle point. The respiratory syndrome is 91% in the case of Delta, 31% in the case of Omicron. So it's not impacting your respiratory system quite as much. AC being acute. So acute, it's not as bad as Delta was. Then the number of days being spent in hospital is 7 days in comparison with 3 for Omicron. So again, in the case of Omicron, the number of days you need to spend in hospital much lesser. The patients who require oxygen support in the case of Omicron was much higher than the number of people who require oxygen support as a percentage for Omicron cases. After this, let's look at hospitalizations again as a percentage. The percentage of people requiring hospitalization for Omicron much lesser, ICU admissions much lesser, ventilator support, a big difference between Delta and Omicron when it comes to ventilator support. And even on the issue of mortality, the number of people likely to die as a consequence of Omicron much lesser than, just as a percentage, the percentage of people who are dying because of Delta. So this is data from South Africa, and I want to go across to Dr. Swaminathan on this, because it's clear that Omicron is milder, but the critical point is, if you're all jumping off a high building, many will survive, but there will be those who will not, and they will die. It might be a lesser percentage, but you don't know at this moment who will survive and who will not, and how your body reacts. And that's what we saw with the Delta variant. You don't know how. I saw perfectly healthy people who didn't seem to have any comorbidities also succumbing during the Delta wave, which is why it's very critical not to take, as Dr. Malik said, this whole idea that it's a mild variant too casually. That's just like playing with fire.
Absolutely. I've seen social media posts calling this a vaccine and things like that. It really gets my hackles up. It's just irresponsible. Think of all the people who are dying. It's not like there are no deaths. There are people who are going into the ICU. There are people who are dying. The percentage may be lower, but here's the point. This percentage need not happen. It just doesn't have to happen. So saying things which are blatant untruths is not serving any purpose. It only puts people in harm's way without any care for their safety, and I don't think it's a very civilized way of handling the situation. Having said that, sorry.
Dr. Malik, how is hospital capacity now, not just at your hospitals but across? How prepared is India's health system to be able to deal with this sharp surge? From what I've gathered on the basis of what I've read and during this conversation with top experts, the next 10 days or 2 weeks is likely to see a hockey stick like increase in the number of cases.
Like if we talk of Rahul, Delhi Health Minister has said that they are well prepared with 37,000 beds, oxygen beds. They are well prepared with that. But having said that, obviously our health infrastructure is much weaker as compared to the developed nations. If USA is facing problems in their healthcare system, so we are also likely to face the problems. But I think the governments are more prepared as compared to the second wave. The governments will not be caught unaware because they are well prepared. And I don't think that there will be any paucity of oxygen or medicines. I don't see that because the rate of hospitalization is likely to be low. But we should be absolutely well prepared. And the main bottleneck can come with the health workers, because we already have less doctors and less nurses as compared to our population. By and large, we need 1 doctor per 1,000 of the population according to WHO. And in our country, we have only 1 doctor for every 1,700 people. And we talk of bed strength also, our bed strength is much less. So health infrastructure and especially the health personals are likely to be more exhausted. They will have to do their double duties, and we should be well prepared for that. But because this variant, as you have rightly said, the hospitalization is less likely to be there because Omicron is not infecting the lungs. It is getting restricted to the upper respiratory airways. So there are less chances that the people will go into ICUs or ventilators. That is what is the prediction. As I've already told you, Rahul, that we have faltered many times in our predictions. So let us see what happens in future. But there are less patients who are likely to land up in ICUs, and probably there will be less mortalities. But definitely there is going to be a big burden, not only on the health infrastructure, but on the pressure on the health personals. OPD rates will increase, number of people attending the OPDs will increase, and of course there will be a load on the testing facilities also.
It's going to be stressful the next 2 weeks. There is absolutely no doubt about it. We wish you, Dr. Malik, Dr. Mahajan, Dr. Swaminathan and Professor Agrawal all the best. Very sharp insights.
Thanks a lot.
A lot of it just seems inevitable. It's like a tsunami is coming. Now you need to duck, you need to take cover. Trying to take a tsunami head on, 56 inch ki chhati and I'll take it head on, that's not smart. You have to take precaution, you have to be as careful as you can, and if you are not, and if everybody ends up ill at the same time, even a small percentage need hospitalization. We're already seeing this in the UK, the US. Healthcare capacities will be overrun very quickly, and I saw horror stories last night from the US and from the UK of doctors not being available because the doctors were ill. There were patients who were coming who required hospital care, and they couldn't be given that hospital care because there weren't enough doctors. So that is a real problem. You can't take this casually. You can't think that this is a mild variant, let's just get on with it. Dekhi jaogi is just the worst way of trying to deal with Omicron.